This is DJ Stowe. She is going to do her presentation on COVID-19, which is something we're all really familiar with, and we know it changes all the time. So she's going to talk to you about that, so I'm going to turn it over to DJ.
Hi, my name is Deandrea Stowe. Good morning. I did my presentation on the recommendations and considerations for return to play protocols for athletes at various levels who tested positive for COVID-19. Just a little bit of background information and a little bit of an introduction. As we all know, COVID-19 started around 2019. Here you have some common signs and symptoms that include fever, shortness of breath, body aches, body chills, things like that. But the CDC recommended a 14-day quarantine for not only athletes but everyone, the general population, after testing positive for COVID-19. And that led me to believe that because of this, athletes are going to need a gradual return to play, leading them back into sport. To return athletes safely to their sport, you're going to need to create a protocol that accommodates these needs for that gradual progression back into sport. This led me to my focus clinical question. I used the PECO guidelines instead of a PICO question, which included a population of athletes at various levels. I focused on high school athletes as well as collegiate and elite athletes. Their exposure is going to be COVID-19. The comparison is going to be those athletes who tested positive for COVID versus healthy individuals. And their outcome is going to be their return to play, whether that be their protocols used or their recommendations and considerations given by healthcare professionals. That being said, my focus clinical question is, how does testing positive for COVID-19 affect return to play protocols, recommendations, and considerations for athletes at various levels? My search my search was conducted in September of 2021. I used terms including COVID-19, athletes, and return to play, and I used databases from the JSU Library and Google Scholar. Most of my databases or my articles came from Sport Discuss and MedLife. I retrieved 87 studies, and 3 of the studies were chosen following the inclusion and exclusion criteria here below. So the studies had to be in English, and they had to discuss all aspects of my PECO question, and they were not included if they talked about other types of sports protocols or other respiratory illnesses such as the flu or bronchitis, and if they talked about general populations, but I wanted to really focus in on the athlete. The Oxford Center for Evidence-Based Medicine scale was what I used to evaluate my evidence, and because all of the studies that were chosen, the 3 that I found that fit my inclusion and exclusion criteria, they were mostly expert opinion at the time of my search. So because they are expert opinion, they received a level 5. The first article that I found, the first study, was for high school athletes written by Capino and Morissette. They really wanted to focus on how quickly they could get athletes back to play, but also safely, since you're dealing with minors, since they're high school athletes. They focused a lot on football athletes, but they recognized that there was a cardiovascular damage that occurs when you have COVID, as well as respiratory damage. And so they recommended utilizing a cardiologist as well as that minor's primary care physician to come up with a collaborative effort to bring that athlete back to play. So it's not just including just the athletic trainer themselves. They're collaborating with other healthcare professionals to make sure that that athlete is getting all the care that they need to be safely put back into play, not just, here you go, you can play. They also discussed the need for a cardiac stress test just to make sure that because their body's still developing as a minor, their heart and lungs could not be developing properly as a result of COVID-19. So just again, utilizing that cardiologist and that primary care physician to making sure that they're ready to push to the next level. The next article that I looked at focused on the elite athlete, so we're talking collegiate and higher collegiate professional levels. They also found that, again, you're going to have some kind of cardiorespiratory or cardiovascular damage as well as respiratory damage, and they saw a lot of renal system damage in older individuals as well from COVID-19. And in addition to modifying their return to play progression, they recommended modifying your strength and conditioning as well as your contact drill progression when you're moving back into sport. So they found a lot of individuals who suffer from COVID were having orthopedic injuries. So not only were they having trouble breathing, but they were more inclined to injure their ankles or shoulder pathologies, things of that nature. And I think when their research pointed to that being because once you take a break from any kind of activity or physical activity for more than 3 days, your body or your muscles start to, and I guess degrade would be not the proper term, but a proper term you could use. So they wanted to focus on building that strength back before you just jump back into your activity. And the last study that I looked at was from the British Association of Sports and Sports Exercise Sciences. And they talked about graduated return to play for athletes at all levels. So it looked at high school athletes, collegiate, professional, as well as the recreational athlete. They believed that there was going to be a longer recovery time from COVID for elite athletes just because they wanted to look at that. They're having a bigger decrease in muscular mass during their quarantine times. So they wanted to focus on giving a protocol that's going to help progress them back into their sport quicker. They admit that there is limited knowledge for long-term effects of COVID-19 and ask for further research in that area. And they recommend that, like the first article, you utilize more of the cardiologists, primary care physicians, and other healthcare professionals, not just on the athletic trainer themselves, to come up with a proper plan for their return to play protocols. They also express a need for educating the coaching staff and any kind of staff that these elite athletes are going to come in contact with. So your coaching staff, your strength and conditioning staff, different for football and specific, like your offensive coach, just educating as much coaching staff as you can on how their return to play needs to be modified. So what's the clinical bottom line here? Everyone knows that COVID has been very prevalent in our time in society over the last 2 years, and it's going to continue to be that way until we take the time to do more research in not only how it affects our general population, but how it affects our athletes and other people moving forward. You're going to have to change how we view our return to play protocols for those athletes, and you're going to need to do a cardiac screening just because of the cardiovascular and respiratory damage that can occur from COVID-19. You're going to need a slower progression through the protocols that you create, and you're going to have to utilize other healthcare professionals, not just the athletic trainer. Some clinical implications for myself as an athletic trainer: 16% of all patients who develop COVID-19 or are diagnosed with COVID-19 are going to experience severe symptoms. So the severity of their symptoms is going to play into account the change in their protocol, making sure that their progression is changed. And even for musculoskeletal injuries, we have a lack of well-established return to play protocols. So we're just like those and how it took time for us to develop those, it's going to take time for us to develop a proper return to play protocol for COVID. And that healthcare providers should be prepared to work together to make sure that they are doing what's best for the patient and they focus on patient-centered care and getting the athlete back into play. Here are my references. And I'd just like to take a second to thank the JSU Symposium for allowing me to speak today. I'd like to thank my professors, Dr. Savage and Dr. Clark, as well as my classmates for being helpful and very inspiring through this entire process. Thank you. Yes.
Hi, great job. I was just wondering, I know that it's still very recent, but do you know how the NATA is involved with any type of position statement for return?
They've released a position statement recently, and because the CDC changed their guidelines to a 7-day quarantine with followed by, I think it's 7 days of wearing a mask, they've also modified their position statement to mimic the same things, just emphasizing on the need for athletic trainers to gradually return their athlete to play after COVID. But most of the position statement mimics what the CDC recommends. Thank you. Any more questions?
Is there any effects from the vaccine in terms of the cardio?
I did
Cardiovascular?
find a article that focused on the vaccine, but it wasn't on the COVID vaccine, it was on a flu vaccine, and it showed that individuals who were vaccinated from that flu that did develop the flu still, they were able to return to play faster than individuals who were not vaccinated. Now, I can't say that that in turn is going to directly translate to a COVID-19 vaccination, but one would believe that it could have the same possibility of having that same effect. I think that that's going to just come down to research and leading to individuals who are vaccinated wanting to participate in that kind of thing. Any more questions? Thank you.